They suspended her legs in fabric slings and aimed radiation directly inside of her body. Not for minutes, for nearly 2 hours at a time. This wasn't punishment, this was medicine. In the early 1920s, a woman with advanced cervical cancer was admitted to a hospital with what doctors called a hopeless prognosis. Surgery had failed. The tumor was progressing, she was losing weight, she was running out of time. So her doctors tried something radical, something no one fully understood yet. They inserted an X-ray source internally and aimed it at the cervix. There were no screens, no imaging, no protective shielding, no real understanding of dosage. Just a glowing tube, electrical wires overhead, and a belief that radiation might do something. They were inventing the procedure as they went. Every session was documented obsessively: the position of her legs, the distance from the radiation source, the amperage of the tube, the exact duration of exposure, not because there was a protocol, but because they were trying to create one. The treatments were brutal, repeated, and experimental. And then something happened that shocked everyone. The tumor began to shrink. Doctors noted rapid changes. Malignant tissues receded, her weight stabilized, blood tests improved. She reported a sense of well-being that she hadn't felt in months. On paper, it looked like a miracle, but her body was also reacting in ways that they didn't yet have language for. She suffered intense nausea, fatigue, weakness, symptoms doctors referred to vaguely as X-ray sickness. They knew it was connected to radiation exposure, they just didn't know how or what it meant long term. Still, the treatment continued, because the cancer was retreating. And in early radiation medicine, that was the only metric that mattered. This wasn't cruelty. That's the uncomfortable part. These physicians believed they were saving her life. And in a sense, they were. She survived longer than expected. The cancer was controlled. The case was published, carefully measured, quietly celebrated. But the harm was treated as acceptable collateral, because this was medicine at the edge of knowledge, and patients paid the price for starting there first. This woman wasn't an anomaly. She was a prototype. Her suffering helped shape radiation oncology as we know it today. Safer dosages, shorter exposures, shielding, imaging, standards that exist because someone endured what no one fully understood yet. She lived with the effects of that radiation long after treatment ended, and the doctors, they kept going because the cancer responded. History often frames early medical breakthroughs as bravery and progress, but progress is rarely clean. It's messy, improvised, built on bodies that absorbed the consequences before science caught up. This wasn't a miracle. It was an experiment that worked, just enough to be repeated. History is messy, confusing, and sometimes refuses to explain itself. Subscribe to Hold My Hourglass if you like your history with curiosity and a little side-eye.